Welcome back to this year's fourth annual Daoist Gate Conference. If you missed the morning, I hope you can catch the recording because we had two wonderful and enlightening lectures by Mary Birgit Pitts and Rory Hiltbrand on trees in Chinese medicine and meditation and consciousness, as well as numerology and sacred geometry from Rory. So those are will be available within a week or two from this conference. And we have our next speaker. When I asked him to be a part of this year's conference, I honestly wasn't sure which direction he would take his topic. You see, this presenter has a background in Chinese medicine and runs the Center for Acupuncture and Herbal Medicine in Plainfield, New Jersey. But he has also gone on to study specific subjects, such as the Shenhammer pulse method, which is an incredible tool of radial pulse diagnosis that straddles the line between Chinese medicine, psychology, and even the esoteric realm. He has some wonderful case studies of using this method and clinical skills to help patients actually change their narratives surrounding the disease, which is an art that you don't really realize in school how much you're going to need when you get out in the real world. He has authored a book called Heart Shock, Diagnosis and Treatment of Trauma with Shenhammer and Classical Chinese Medicine. Additionally, Rosen is a Taoist priest from Quanzhen Longmen and Maoshan lineages. He has a specific emphasis on Taoist medicine, such as talismans, incantations, and scripture. Instead of using the aforementioned modalities separately, he weaves them together to create a unique form of healing in his personal practice, and also teaches continuing education around this integrated approach in his retreat center in upstate New York. So let's welcome Rosen and see what he has to say.
Thank you so much, Em. I appreciate it. And thank you to Master Joe and everyone who's attending and who will be sort of watching recordings. It's really a pleasure and an honor to be here and to have been included. I would love to share my screen if I could do that for the PowerPoint. So what I will be discussing today is a little bit about the integration of Chinese and Daoist medicine. So can everyone see this? Okay. Yeah. Okay, great. And so what I want to do to some degree is demonstrate the intense resonance between these two systems of medicine. And although they come at it from slightly different perspectives, the end goal, of course, is very similar. And so part of the goal for today is to present this sort of methodology that I have been using over the course of many years for integrating these two powerful medicines into a therapeutic relationship with patients, because I believe that to be the cornerstone of any healing dynamic. And so the questions then become, how do we create resonance between the doctor and the priest, right? And doctor, priest, and the patient? Because if that's a necessary ingredient for the initiation of this alchemical healing process, we need to understand how to spark that, right? And I also want to talk a little bit about zhuyou, talismans and incantations. And then at the end, hopefully we'll have time. I want to just demonstrate and teach you guys a talisman that may be useful for you if you're someone who treats patients, or even to be used with potentially anyone in your life that is suffering and navigating the difficulties of anxiety, panic, depression, and so forth. So I chose one that is sort of a simpler talisman. It's sort of an open talisman, and it's one that is wildly useful for a whole host of different populations. So I know that outline is quite a lot. It's a little ambitious. Typically, this is a course that I teach over. This part is one full day that I'm condensing into an hour. So I'm going to move quickly through some of this stuff, and I've condensed it to the most salient pieces. But if I'm moving too quickly, please, please try and slow me down. So when we're talking about medicine and Chinese medicine and Taoist medicine, of course, we can go back to the Suwen and one of our oldest texts from thousands of years ago. And what is instructive here, and what we will see is even more instructive in today's world, is that the Yellow Emperor was saying that he's heard that in ancient times, right now, this was ancient times, so they're referring to even further ancient times, that curing the illness only required moving the vital essence and transforming qi to exorcise the cause of illness. And now we use drugs and medicines to treat the interior. And why are some patients cured and others not, right? And so the answer, of course, of Chibo is that in these ancient times, people lived in resonance with nature, with animals, right? They exercised to avoid cold, and they lived in secluded places to avoid the heat, right? And inwardly, and this is really one of the most important pieces of what we're going to discuss today, they were not troubled by envy, desire, right? Outwardly, they appeared unperturbed. And in this type of serene world, the pathogens couldn't penetrate very far into the body. So as a result, all that needed to be done was to move the vital essence and expel the cause of illness. But of course, we know our world is not so much like this. Worry and anxiety are ubiquitous and epidemic. They hurt the interior. These hardships damage the exterior of the body as well, right? And so people's lives are often in chaos and disarray. They're no longer living in accord with the four seasons, especially, we have artificial lighting, artificial heating. We have abilities to make food whenever we want, right? So all of these things sort of push us in a way that sort of disconnects us from this natural rhythms, right? And because of this, what Chibo was saying, that even minor illnesses, right, become more severe, and serious illness can result in death, right? And what he's saying is even expelling the cause of illness at this point still cannot even stop it, right? And I want to highlight, this is my sort of input here, but when they're talking about the cause of illness, they're talking about the overt cause of illness, right? So someone gets struck by a wind cold invasion or a bacteria, virus, something like this. And so even addressing these overt causes, we're not able to stop the progression of illness. And so here now we can look at the entrance of zhuyou into this powerful dynamic to unlock the hidden causes, right? The covert causes of disease. And so zhuyou is referred to in the Neijing, and famous Chinese medicine have practiced this through the course of, early in Chinese medicine history. Famous practitioners like Sun Sumiao, Ye Tianshi, Li Shizhen, Ge Hong, Wu Zhutong, Zhang Jiebin, they were all practicing zhuyou. And this was a vital part until it was eradicated in the Ming Dynasty, and then sort of became more into the realm of where the Taoist priests were practicing. And so in the Neijing, we see these discussions between Chibo and the Yellow Emperor on how incantations and prayer can be used to treat illness with causes so minute and subtle that they could not be detected by the senses. And they termed this phrase as if ghosts and spirits were the cause of illness. And this becomes a little contentious over time. Is it ghosts and spirits causing the problem, or is it that these are things that are so minute and internal that people aren't able to detect them? And we're not going to debate that today. That's you can go into the history and look at some of that. But here, Chibo is explaining that the blockage is due to unharmonious lifestyles. And so the difference in impact, the ability to diagnose and treat, right, when internal unknown causes are involved. This becomes very tricky to the Chinese medicine practitioner or any practitioner of medicine. And we'll talk more about that in a little bit. So let's define what zhuyou is, right? It's a system of medicine that incorporates prayer, incantation, talismans, mudra, and oftentimes herbs combined with a doctor-patient relationship. This is essential to determine and treat the patient's illness, right? So it's meant, again, to treat disorders with a hidden root, and that could be things like blockages of qi that are not perceptible, possessions, emotional imbalances, or even moral, ethical violations that are sort of harbored in one's heart. And this is, again, something we're going to talk about more. So the way zhuyou is often done is it was creating a ritual healing space. And this space was filled with different types of symbolic representations. And it allowed an environment where all the parties could work together to uncover the root causes. Okay. And at the heart of this was the use of prayer. And the purpose of prayer was to manipulate, I'm going to use a different term, bring awareness to the imperceptible or occult causes of illness. And there are some articles that I'm referencing. A lot of this early historical stuff is coming from, I think it's like 3 or 4 different articles on zhuyou that you can find that are really excellent descriptions of what I'm kind of summarizing. But zhuyou, and just like Chinese medicine, allows for many simultaneous meanings and coexisting causes of illness. And we've mentioned some of them already, right? The idea of possessions, ghosts and demons, or blockages in the flow of qi, emotional imbalances, or harboring vices, right? And this idea that there can be simultaneous meanings and coexisting causes is going to be really important for us as we move through this next hour, because I want to highlight this piece, because oftentimes in our modern world, we're looking for some definitive cause. And I will argue that oftentimes that doesn't necessarily exist, okay? So at the heart of this, allowed and relied upon the patient's participation, okay? Now, this participation is generally guided by the practitioner or priest, right, in naming the affliction and the decision on when treatment has been effective, right? And so this is a very different model, right? In Chinese medicine, even in Western medicine, the doctor tells you what's wrong. He diagnoses or she diagnoses you, whether it's a blood work or an MRI or something very sort of objective, and they set the course of treatment. And what we're going to argue here today is that a more efficacious approach is when you create patient buy-in. And you create the patient buy-in by gaining feedback, by understanding the patient's lived experience, and by helping to navigate the diagnostic process to create resonance. Okay, this is really important. So whenever the body loses its healthy equilibrium, it's the spirit that first experiences it, right? This is sort of at the root of Chinese and Daoist medicine. So there's no possible treatment for a disease under this approach if the doctor does not first address the desires, correct the thoughts, eliminate the vices, and appease the fears that cause the condition to appear, right? And now this is echoed by many famous practitioners. We see Wu Tong saying things like, for inner ailments, zhuyou must be used first. This means explaining in detail the causes of the condition so that the patient understands them and does not dare make the same mistakes again. This is really important, right? How often, like, think about like a sports medicine clinic where someone goes in with an infection and they just, the practitioner treats them so they can get back on the basketball court or the tennis court, and without really addressing the underlying concerns, someone feels better, they go back out for a little while, and they wind up injuring themselves again, either the same space or someplace else, right? Or we take an antibiotic, but we don't really understand the dysbiosis that's occurring and the underlying causative conditions that were there. And so we do damage to the body from the antibiotic. Maybe it gives temporary relief, but then something else comes out as a consequence, right? So practitioners like Sun Simiao, Li Shizhen, Go Hong, they all incorporated these ritual therapies into their medical writings, okay? So you can, I'm not going to go through all of the quotations here, but I just want to impress upon you that these have long-standing historical precedents for the use of these zhuyou approaches. So from the Ling Shu, it talks about, instead of expelling ghosts, zhuyou was particularly apt for treating disorders whose origins were so minute and subtle that they resulted in a stagnation of pathogens in the body that could not be seen or heard, right? So in this sense, hidden and mysterious causes of sickness, which rituals were particularly suited to treat, were occult. So in our world, we may think of this as something like latent pathogens or retained pathogens, right? So from the Suen, Chibo laid emphasis on zhuyou as a therapy for correcting a disruption in the flow of qi caused by the patient's improper behavior, right? This is important because this puts much of the responsibility back to the patient who's not living in accordance of, and when we say improper, I want to just clarify, we're not making judgments. This is not about good, bad, you're a bad person, you're a good person, you're an ethical person, you're an unethical person. We want to sort of shift the narrative here a little bit into things that are good are things that are promoting health and well-being, right? So it's not a judgment about the person as a whole, right? To the internal being of this person. It's about how they are living in accordance with the seasons, with nature, with their own body and their own limitations, right? And so at some points, the physician would perform rituals against evil spirits, right? If there are external agents afflicting a more passively portrayed patients. The incantations were often for treating the imperceptible causes that only appeared as if ghosts and spirits were the causative factors, right? So the patient played a role here in uncovering this hidden cause. And so when we look at the different types of techniques that zhuyou used from a religious perspective, they were meant to move the gods. And I'm going to bridge this religious perspective to a more secular perspective in a few minutes, right? So only someone who has purified themselves through ritual would be able to convey these feelings to the gods to stop illness, right? This required a sincere heart and a focused mind. These were prerequisite. So, and to attain this, one must ritually purify and discipline one's conduct according to ritual restrictions and so forth, right? This was a sign of virtue. And so with every brushstroke when writing the talisman or the zhuyou character, and with every ritual gesture, the priest or practitioner was gathering and focusing their emotive power, right, their sincerity, their intention into the performance. Just as the calligraphy and the dance and other arts translate this energy, so are we translating this energy through the calligraphy brush and ink onto the paper itself. Okay, so we are literally translating energy into words, and these words have the healing dynamic and intention embedded within it. Okay, so we know that speech is the sound of the heart. Chinese medicine talks about this, the tongue being the sprout of the heart, and writing is the graphical expression of the heart. And so with this perfect sincerity, we're able to impact and affect the charms and incantations with this internal expression. And so within the sounds and symbols is the power to make even something humble the most splendid and something coarse the most refined, right? So some of our Taoist scriptures even talk about the idea of that most people understand the sacred of the sacred, but how many people understand the sacred of the mundane? And then understanding that there is no such thing as the mundane, right? It all comes from our intention. It's all part of the unification of the Tao itself and nature itself. Okay, and so we are utilizing the emotive power, the sincerity, the intention of that expression into something that becomes a sacred expression that will impact our patient, right? So in other words, this purification and the sincerity and the intention, or this emotive power that the practitioner is engaging in, as well as the entire process of this ritual, is what gives the qi the meaning, right? And so the efficacy of this modality was that we were negotiating the process. The patient's role in naming the affliction is essential, right? It allows the patient to find the power to heal from within, right? And this is really important because, we want to be clear too, that this is not some willy-nilly, the patient just thinks some crazy thing is causing their illness. What it is a guided process that allows the practitioner to uncover the patient's ability to express their own lived experience of their illness. This is really crucial. They have to be able to name it. They have to be able to create awareness of it. It's the awareness that is the unlocking of this healing spark, okay? And so, and in terms of relationship to non-duality, which we're going to talk a little bit more, like this is like the root of Taoist practice, right? And understanding in Taoist philosophy. If we understand non-duality, we understand that we're all sort of, there's a oneness beyond everything. And by that, we mean that everything in the phenomenological world that we perceive is construct. And if we can move the construct into something that is not limiting to the patient's healing process, we can open a boundary that now allows the healing dynamic to flow freely through this patient. Okay. And this is why, too, when we're talking about the difference between the Western medical model, perhaps, or maybe the modern medical model, we should say, because it's not even just Western medicine that does this, of the doctor on high and the patient down below who has to sort of listen to this diagnosis, even though it may not resonate. It's very hard to get buy-in. It's very hard to force a patient to do a therapy that their heart just isn't in, right? And so we're trying to bridge this gap between, and knowing and understanding what we know about non-duality, we know that there is no subjective truth here that is gonna trump someone else, right? And so if we can meet this patient and guide them to this understanding, we create what one of my teachers, Jeffrey Yen, called a healing conspiracy, right? We conspire with our patients to understand their illness in a particular way that allows them to be freed of the shackles and the bonding and bondage of what this ailment is creating in their life. And if you think that sounds silly, I would point your attention to the fact that every single diagnosis a doctor makes and that you believe is a healing conspiracy. There's no difference in meeting the patient and explaining and creating the shared experience than a doctor telling you you have cancer and you believing it, right? Or the doctor telling you you have 6 months to live and you believing it, okay? These are one and the same, and we can choose to utilize that conspiracy in ways that are fearful, or we can use that conspiracy in ways that are empowering to our patient's well-being. And that's really important. So the major role of the physician here was to morally guide the patient. And it was more than just an act of persuasion, right? It's not a denial of alternative beliefs. It was something that allowed for a reinventing of a shared dynamic that unlocks the healing process, okay? And so one of the ways that we do this in Chinese medicine, at least how I do this in my approach, is through the Shenhammer pulse method, which Sam alluded to before, which is a very sophisticated model of understanding what's happening in all the different organ systems, areas of the body, and so forth. And so I actually, when I take someone's pulse, it takes about a half hour the first time, and you actually fill out an entire page of information. And then after that, I take that information and I narrate it back, tying in all of the different diagnoses into the signs and symptoms and lived experience of the patient so that they understand the impact and the import of all the different things they've been doing in their life. And that creates a particular degree of resonance, okay, which is really important. So Zhang Jiabin talked about immoral proclivities and the long harboring of vices as playing a role in this. And these are things that come out in this pulse diagnosis, because we can pick up things like anxiety, depression, fear, shame, guilt, and we create an avenue with which to explore some of these deeper emotional roots to our patient's problems. Okay, so knowing what overcomes illness, knowing from whence it arises, and being able to expel and stop it, right, mean to seek out the underlying cause and expel the ghosts within the heart, right? So we can think of this from a secular perspective as depression, anxiety, guilt, shame, all these different things that are happening that have been internalized from early in life that are playing a role in the patient's imbalance, okay? So it gives people this opportunity to articulate so many of the unspeakable thoughts that a person harbors, right? They wouldn't say out loud, they wouldn't say to a family member, and so they've been sort of holding this internally. That allows, during the pulse, which reveals some of these things and brings it up into the open, bypasses this idea of resistance from our patients, or the shame or the inability to initiate this discussion. And so we do this via the pulse explaining what's happening and then creating and opening up and unlocking this dialogue, right? So the importance of the narratives and the storytelling is essential to the patient-practitioner relationship, right? And there's lots of ways we can do this and create the story. And I don't know how much time we have to get into all of these things because there's a lot to talk about today, but it ties in the patient's history, right? All the different circumstances surrounding the onset of the event, right? It talks about the unwinding of this sort of person's internal mental emotional state. We have to make it relevant to their past history, right? To their family history, to their upbringing. We have to show that it's an expression, right? Bring it as an expression out in the open so it reveals the patient's struggle, right? We don't want these things creating disempowerment of our patients. We bring things into the open to empower them, to deconstruct the harmful narrative that they've been living with for so long, right? And so as we tie into the patient's experiences and beliefs, we may talk about things like ethics and morality. We may talk about the creation of intimacy through the pulse and these deep things that we're able to sort of explore and bring out from these repressed places, right? So one of the things that one of my main mentor, Dr. Hammer, would talk about is how do we get people to share what's in their deepest of hearts, right? And this is essential to unlocking the healing dynamics. And when we look at pulse diagnosis, we know that from all the different 4 diagnostic pillars of diagnosis in Chinese medicine, we have the looking, listening, asking, and palpation portions of our diagnosis. It's the palpation of the pulse that allows us to see the areas that have been repressed, hidden, unknown, even to the patient. Again, remember, zhuyou. Zhuyou is about the occult. It's about the covert causes of illness. These are things that have been so deeply suppressed into shadow that oftentimes patients are not aware of these dynamics at all. And we have the ability to bring these things out into the open, to shine light on them, right? So I'm not going to get too much into this, but these are some of the a chart of a few different pulse qualities that we can see. Things like rough vibration, this thing that says RVib here. When someone has a rough vibration over their whole pulse, it's a sign that they've experienced a major trauma. And not just a trauma, but a trauma that rises to the level of creating a certain degree of instability and chaos in their physiology and psychology. And so when we look at things where someone has a rough vibration and someone has this, we see muffled left distal position in the heart, we know that someone has experienced a trauma that has impacted their capacity to feel joy in their life, that is creating a certain type of cyclothymic depression, okay, that we now can bring out into the open and talk about it and evaluate, right? We can discuss all the factors around this and bring this to the patient's awareness of where the root comes from. So no longer does this person have to feel shame about what they're experiencing and the feelings of not being able to express joy into their wife or their children. Now we've just uncovered a root cause that can now be treated, right? And this is super powerful. And so there's, over 90 different pulse qualities and sensations that we can perceive under the fingertip, and the way that they combine themselves in each place and location and area of the body tell me what's going on in all these different places. So as we're doing this, and as we're feeling the pulse, and we're parroting the narrative back to the patient, there's certain principles that we want to think about. And Dr. Hammer elucidated a number of them in his wonderful book called The Patient-Practitioner Relationship in Acupuncture. And so one of the first and foremost things of this is that the person comes to you because they want to get back to their lifestyle without paying the consequences. And right, so our job is to guide them to see how their lifestyles are contributing. We connect the dots for our patients. This is really important in the story formation. And I'm just going to move ahead real quickly to this. We'll come back to that slide in a second. But understanding that every single thing that you figure out, sign, symptom, pulse quality, they just look like this. They're just dots. They're just data points. The question is, how do we communicate and connect these points so that it has resonance to our patients? And so we do this in as skillful a way as possible. And hopefully, if we're doing it adeptly, we create an outline of a story that starts to take shape. And if we do it really, really well, and we're creating this resonance, we wind up creating this beautiful masterpiece for our patients that unlocks the story of their own healing journey, and now starts the process of sparking the alchemy that we talked about before. But, sometimes we get lots of pieces right and we get some pieces wrong. And how do we gauge that? We gauge it by the resonance with our patient. So sometimes we get something that looks like this, right? And this is where the story, we got some elements, but there's a distortion here. And this distortion needs to be clarified and rectified by bringing something into a tighter resonance with our patients. And we do this not by saying, oh, I'm the doctor, this is what it is, because that would be foolish, right? That would be just ego at that point. And ego has no place in the treatment room. And so we're looking to create the resonance so that we can guide the patient. They're not guided by this distorted picture. It's this picture that's going to guide them into understanding where their healing journey needs to go. Okay. And so we have to have respect as the foundation to this relationship. And that goes along with what I'm just saying. We can't just force someone into believing something just because the doctor, say it, right? So we have to be objective. We're not imposing, we're not being heavy-handed, we're not creating judgments, right? Our job is to bring out and uncover what patients fear is crazy in them and to release them of that fear. That is one of the most powerful quotes that has been imprinted on me from my relationship with Dr. Hammer. It is wildly, wildly powerful in the healing dynamic. We have to use our intuition to interpret and respond to the patient in this way, right? We have to understand that it's this movement and balance of energy that's the critical factor in sickness and health, and help our patients to see it. We provide our patients with courage, right? So in Taoist medicine, we may use that as like, that's thunder medicine, right? We do this in lots of different ways. We can do it in our speaking. We can do it in talismans and zhuyou and all sorts of ways. But we have to give patients the confidence that they can heal, right? And we also have to know ourselves to do this process. We have to have undergone our own sort of what Dr. Hammer calls our descent into hell. Like, how do we manage patients if we haven't done the work ourselves, right? And this is the big difference between a practitioner who has embodied the work versus someone who knows it from a textbook or philosophically. We're not the philosophical type of practitioners. We have to embody what we do. We have to live what we preach and utilize with our patients, because we have to serve as a model to our patients. If we're engaging in the exact same vices that we're counseling our patients not to engage in, we're going to have a little trouble. We're not going to create the resonance, the respect, the trust. Okay. Listening with the third ear, right? We have to be aware of the subtext, right? The things that patients don't want to tell us that's visible, or they want to tell us, but they can't. They can't say the words. So we look at their body language, we look at their eyes, we look at the way they're positioning their face and their reflections to what we say. We have to be able to hear the different contradictions to what they're saying, right? We know about the different kinds of voices when a patient has a crying voice or nervous laughter while describing pain. We know what these mean. We know it's a mask that's being worn that's hiding something else, right? And we have to be able to reframe things, right? And one of the things that Dr. Hammer talks about is if we accept that qi is real, we have to accept that it's real in all of its manifestations, right? And so we have to acknowledge it in its totality, that there's things that the mind is part of this process. And the same thing with non-duality. If we understand that there is a oneness to everything, we have to take that to its extreme, that I am my patient. I have to create the resonance with my patient. If I can't create resonance with my patients, then I'm treating the patient as an other. And now who's doing the work? Now it's ego against ego in this healing dynamic. And we don't want that, right? That's a barrier to the healing process, okay? So a few other things quickly, like providing feedback is really important. We have to give our full attention to our patients. We have to have them understand an experience of what it's like to be seen and heard. Sometimes this is the only time in someone's life where they feel seen and heard. Sometimes it's the only time in a healing encounter where a doctor is actually touching them. We feel their pulse for 30 minutes. Think about the intimacy, the interplay of qi and energy that is moving back and forth with your patients, and how that creates a certain degree of trust, right? This is really, really important. We have to be present. We have to be able to hear their story. It's really important. And we have to be able to parrot that story back to them and help to guide them to a story that allows for healing and understanding to take place, okay? And lastly, we're only of value to these people if we can offer them something significantly different from the usual response. How many times does a patient who's in extreme pain come in and they're angry and they're grumpy? And if that gets to you and you wind up getting tightened or contracted and you can't give them the kind of compassion, or you respond in a way that's tight and contracted or angry back or passive aggressive, you're not creating an open healing space. Okay, so this is really important. So we're providing patients with self-empowerment. We shift responsibility to the patient, we offer them an opportunity towards growth, and we help them reclaim their power. We are not dominating them. We don't assert our power over them, right? One of the things that Dr. Hammer has said is the greatest source of our suffering are the lies we tell ourselves. We all do this, right? This is not just our patients. So reflect on that for yourself, right? So if we treat just signs and symptoms without reading in the story of the person and their lived experience, it's a denial of the role with which the patient plays in his or her own disharmony. And this is a really important part that Dr. Hammer. Now, Dr. Hammer was not just, one of the most well-known practitioners of Chinese medicine. He was also a renowned psychiatrist for many years. And so this is really important, a really important pointer. And one of the things he talks about too is this idea, and by this I don't mean that there's never a place for psych meds, but oftentimes psych meds are used as a way of sort of like just suppressing things, right? Most people, oh, you're depressed, go on an antidepressant. You're anxious, here's an anti-anxiety. There's no delving into the underlying issues, and that's a disservice to our patients. Okay, so back to zhuyou. So one of the things that Zhang Jiabin said was, once you know the root of the disorder, then you have a method for curing it. How do you cure something if you don't know the cause, right? So you have to investigate what the patient hates and envies and investigate what is overcoming the body's defenses and from where the affliction arises. Then zhuyou is always effective. This is called knowing where the disorder arises, okay? This is really important. So whenever the body loses equilibrium, there's no possible treatment if we don't first address these things. We have to address the desires, correct the thoughts, eliminate the vices, appease the fears, okay? So, and this means explaining in detail the causes of the condition so the patient understands it and doesn't dare make the same mistake again. I know of so few practitioners who explain the diagnoses to patients. This is the most important thing I do before I treat anyone. So let's talk about treatments a little bit. So acupuncture, herbs, diet, all these things are part of this, but I want to talk about talismans, right? So from a Taoist perspective, talismans are considered to be like cloud script, right? It's like the true name and true form of deities themselves. And so the purpose was bringing this to the mortal world, and these were sort of like these images that gave form to the formless world, right? And so this cloud or celestial script was said to originate in the heavens, but it didn't abide by normal language because it represented the fundamental and innate essence of the true name of a deity, right? And so from that perspective, the script on a talisman wasn't just a visual representation of the deity, but the very deity itself, okay? And so the presence of it also authenticated the ownership of the person who was able to write it, okay, and their spiritual achievement. So understanding that, then this talismanic script is the closest thing to the manifestation of the Tao, right? And so it spontaneously took form and derived from the pre-heaven state into the phenomenological world. And so possessing it is said to have given the holder of it control over the deity, the authority to wield it and enact action, right? And part of this idea was that if we're able to name the deity or the gui, right, the spirit, then we're able to treat it. That was very important in the belief system of the Taoists. And so that's not so different than what we're talking about here from a secular perspective, right? So what's the idea of a gui, of a ghost or a demon? It's something malevolent. It's something that's hidden. It's something that can do harm. And how do you combat that? You bring it into the light. You name it. You bring it into awareness. Then you have tools of subduing it. And that's the same thing for health. What's the value of a diagnosis? Prior to diagnosis, it's just something that's bothering you. You don't know what it is, and it's hurting you. And because it's hurting you and you don't know what it is, you can't treat it. So you identify it. You bring all the dynamics into the light to be seen. That's the first step. And now you know what you can do about it. And it doesn't matter how you treat it, from what modality, right? But you have to name it, right? And so I want to be clear that talismans are not just religious, right? They're used that way in the Taoist perspective. But my definition of a talisman is something that creates resonance between the basic underlying energetic reality that we perceive in various ways. Okay. And so if Taoist theory is rooted and predicated upon non-duality, right, this ineffable, experiential, and non-conceptual reality that we are all consciousness, just at all different levels of awakening. And if we understand that, then we don't have to go to an altar to pray or pray to deities necessarily, right? And it doesn't mean that there's no need or utility for lineage-based things or religious-based things. I'm not knocking it. I mean, I'm a Taoist priest. I've done this, right? What I'm saying is it's not necessary, right? What's important is that one have deep cultivation, right? That's the prerequisite, not religious dogma, right? So these prerequisites are openness, sincerity, expansiveness, intention. The ability to open oneself and impart and infect openness in one's patient. We need to break down the boundaries, right? We can't do that if we don't do it ourselves. That's where the magic happens. That's where change is affected. It doesn't matter if the modalities, acupuncture, herbs, massage, talismans, they're just the instrument. The ability comes from the practitioner. And so everything in the world of form is ultimately unreal, right? It's construct. That includes talismans. But it doesn't mean that they have no impact on the world of form, right? Right? We know about the butterfly effect. We understand that, the higher the cultivation, the greater the impact. And it's not about deities per se. These are archetypal representations of our own cultivated attributes, right? Placebo is one of the highest forms of medicine. right? People knock placebo as it's a problem. I would tell you placebo is 99.99999% of medicine. If we can have tools to create a strong placebo, what else do we need, right? If I can speak words to you that cause your healing, I don't need an antibiotic. I don't need anything else, right? I don't need a talisman. So this is really important. And so what I want to also impart is this idea that the pulse record that I was talking about before, I'm feeling someone's pulse for 30 minutes and I'm getting all of these signs and pulse qualities and I write them down on this big record. That's the tally. That's the other half of the tally. The first half, see, normally in Taoism, the half of the talisman is written, it's up in the celestial bureaucracy. And then I write it down on my paper and I match that, create a perfect resonance between the celestial bureaucracy's talisman and my talisman in written form. And then boom, I unlock it with the incantation, right? And create the power. Here, the other half of the tally is the actual energetic symbolic representations of the energetics of what this patient is communicating to me. I write that down as a reflection of what I'm feeling. That's the other half of the tally. Now I've got a talisman that's perfectly matching what this person's body and health is telling me. And then I parrot the story and the narrative back to the patient, creating a perfect resonance to the felt, experienced, lived experience of the patient. And now that's the incantation that sets the talisman into effect. Okay. So the pulse quality sensations they're the closest thing to the manifestation of the patient's energetics and mirrors their lived reality, right? So being able to record that and report it back, that's your legitimation. You don't need to be a priest to do it. Being able to do it accurately and expertly and in a way that negotiates this lived experience to the underlying processes that are explaining it, that's your legitimation as the practitioner, and that forms the spark of the healing relationship. That's what helps foster trust and respect, right? Okay, so it is bringing the symbol and the formless into the world of form, right? It's not any different. And so in this realm of form, we have to understand, and we know this intrinsically, a lot of times we don't really think about it or talk about it very much, but language, ideas, right, in the realm of form, that's what gives power to more power than cause and effect, right? The sympathies, resonances, intentions, personal will, that all linguistically magnified through poetic rhetoric, right? This comes from Terence McKenna in the Food of the Gods book, wonderful book, right? The world is made of language. Recognition that language is not merely a device for communicating, but it's a tool for bringing the world into existence, right? We know this. It's not just an experience reflected. It is actually creates and experience is produced by the language. And Taoism says this, right? Tao Te Ching 1, the nameless was the beginning of heaven and earth. The named was the mother of the 10,000 things. The phenomenological world comes from the naming, right? The Ling Bao Tianzhen Baoga, the Shangqing Hao, from the red writing, out of the chaos, the nine heavens open, right? From the incantation of the mysterious collection, cloud script was written upon the great void, the beginning of the era. These are not unique concepts, right? In the Bible, right? In the beginning, God created the heavens and earth, and it was a formless void. Then God said, right, language, let there be light, and there was light, right? In the Sefer Yetzirah, through language, humankind was created, right? So the cosmos is this tale that becomes true as it tells itself. This implies that the human imagination can seize the tiller of being in the world. Our thoughts, our emotions, our speech, the language, that creates the reality, right? It doesn't have to be that you're a Taoist priest and ordained, and so now you can write a talisman, right? The impact of words is incredibly profound, right? It can change the reality as we speak it, right? I think about the work of Dr. Emoto, the Japanese scientist who worked with the water crystals, and he spoke loving words, and these crystals formed into the most beautiful of forms. He spoke mean words, and they were like all, horrible and out of balance, right? We can do this with our patients, as we do this with ourselves as we speak, and we listen to our own internal narratives, right? So this Russian research that talks about reprogramming human DNA using words and frequencies. We have to understand the power of what we do. And that power doesn't just come because you go to China and get an ordination and can write a talisman. This power comes from every single word that you speak. Okay? Think about the difference of, you write a note or you say something, a love note to someone and what that does to someone's spirit, or you say something mean to someone and what that does to someone's spirit, right? This has powerful impact. So quickly, I wanted to show you guys a talisman. And so, my book, it's called Heart Shock, and it's about treating trauma with Chinese medicine. But it's one of the most common afflictions that people suffer from. All the things that we're talking about, with zhuyou and these covert hidden causes of illness. And so heart shock is these traumas that rise to a level of instability, and they create a whole host of the sequela and downstream impacts on our physiology and our psychology that create illness and disease. And so I want to just give you a quick talisman that can treat or start to treat the impacts of trauma by treating the anxiety, depression, panic, and so forth that can come as an impact of it. Okay, because the other side of trauma, which is really important, which is the main theme in my book, which comes from hexagram 51 of the I Ching, is that we use it as a platform for growth and development. Every single thing is a platform for growth and development. So we don't want to get into, victim modes where we're suffering from particular ailments and we feel hopeless. That is in and of itself a gwei. That is the covert hidden cause of much of the illness, that sort of type of thinking. And so we have to use these things as platforms. And so there's this talisman, here it is right here. So it's the calming spirits and emotions talisman. Okay, so it's the Ding Xin An Shen Fu. And so this is what it looks like. And the process is sort of written on the left here, but I'm just going to walk you through it really quickly. I know we don't have a lot of time, and I want to give some time for Q&A if anyone has questions. But basically, this is drawn on yellow paper with red ink. Typically, that ink has a little bit of cinnabar mixed in it, and using what's called yin and yang water to mix the ink a bit. And yin and yang water just means that it's water so half the water comes from fresh water that you've boiled and then sort of cool down a little bit, and the other part is some fresh moving water from nature, and you mix them together to create the yin yang dynamic. But as you're writing this talisman, can you guys see my cursor? Yeah. So generally, the process of writing this it basically follows the writing of all sort of Chinese characters. It's going to be mostly from left to right, but except for the beginning part here, you start with this first hash mark, and then you go to the second one to the left, and then the third one is on the right. Okay, so that's the order for writing this top part. When you're writing these three marks, there's a prayer that's to be said. Okay, so as you do the first check mark, you're reciting Ibi Tian Sha Dong. As you make the second check mark, you're reciting Arbi Zushir Jian. And the third one, Sanbi Shongshen Sha Zhou Chu Qian Li Wai. Okay, so while you're actually writing it, you're doing that. Okay, and then you're writing this portion here, which is called the Chirling, which is basically sort of like the order, right? It's like the command. And then you have this part here where you start from the top left, you come down, make the loop, middle loop, right loop, and then finish it up top here. Okay, and then you do these little left border, the right border, and then this little cane-like form, and then the 5 check marks, slashes come in this order here. Okay, so and then after you do that, what you're doing is you're using your sword fingers, and then you're tracing it again. Okay, now Taoists use the sword fingers because they're emitting a certain amount of what they call, jingguang, this energy that they've been cultivating. If you don't feel like you have enough of your own energy to do that, you can use ritual implements. You can take a few incense sticks, 3 incense sticks, and light them and use the tips of the incense sticks to trace them. If you don't have paper and ink, you can take 3 incense sticks and draw it on the patient that way too. Okay. Once you finish this, you say this incantation to say, and that incantation is here, which I can send this to people so that you guys have it. And this is, so there's a 1, 2, 3, 4, 5, 6 lines basically, and then like a little ending, which is Jiji Ruling, which is like to swiftly enact the order. But I have the, a rough sort of translation here that I did. But the impact of it, I don't want to get caught up in the translation and in the actual incantation, just the idea that this is something that as you create the talisman and as you put your own energy into it and your own intention into it, and as you recite the incantation, you are imparting that emotive power that we talked about before into this dynamic and using it as a tool of healing. Again, not that you're forcing and commanding some deity to do the work for you, but just by the nature of what we talked, the power of language that we talked about before, and the cultivational power of intention and sincerity, that you are initiating a healing response into your patients. Generally, then this talisman is then burnt, and then the ashes are placed in water mixed with a little bit of licorice, okay? And then the patient drinks it down, okay? So I'm trying to think if anything else I wanted to mention, anything else. Again, sometimes these things have symbols that we don't always know exactly what it's representing here, and that's okay. You don't have to understand every little dynamic. I mean, you can, like, when I look at this graphically, right? And again, this is not, I'm not imparting that this is what the Taoist intended in any way, shape, or form, and I don't want to be anachronistic and imply that. But if you look at it, it has this sort of like shape of a heart, which is interesting. And if you were to take the character Xin for heart mind and draw it like, in a calligraphic way, you can overlay it on there in a sort of an interesting way, which I've done. Again, not being anachronistic, not saying that was the intention of it. I have no idea. Probably not. But I think if we're looking about sincerity and intention as creating a more powerful resonance, then that's okay to think that. It's okay to have that in your mind. This is about treating someone's heart, mind, and spirit, right? And calming that, okay? So, okay. I went through that real fast, but I made it 8 minutes to spare. And if you guys have questions, I'm happy to. Let me stop my share real quick, or should I keep it up for a minute so you guys can copy anything, or was that helpful? I'll leave this one up first. Yeah.
Awesome. Thank you, Ross. As we've stated at the beginning of the conference, if folks could write their questions in the chat, that's the easiest way to get this done.
Mhm.
I do have a question if I don't see anything immediately pop in there. You mentioned that you lead your patient to name the affliction that they're dealing with. What are some of the ways that you end up leading them there?
Well, so the lead comes from the pulse. And from my understanding and experience of seeing how those pulse qualities create the picture of what they've been experiencing. And so as I'm explaining the Chinese medical diagnostics as I see them, I am sort of tying that into their signs and symptoms and the history that they've expressed with me. And I'm looking very specifically for head nodding, questions that they may have. Almost invariably, I keep a box of tissues on my desk because almost invariably patients start crying, because it's the first time that someone has been able to sort of see them in a totality in a way that no other doctor has sort of been able to sort of piece together, because we're not just compartmentalizing things. We're looking at the whole as well as all the individual parts. And so it's less about a convincing than it is about a showing and looking for response, resonance, questions, things that they may not understand well, that we can sort of bring out more fully in the discussion. And we always try and tie things back into sort of that early life history, experiences that they've had growing up, traumas, major events in their lives, those kinds of things, to make those pieces a little more refined And so they can see the threads that have sort of taken place and connect them over the course of time, not just in a moment. The problem is if you just look at a moment in time, right? That's like what a blood test does or something. It's like it's captured like a moment in time. And then you only see the moment. I go, well, but why is my thyroid low? Well, your thyroid's low because you had a trauma when you were early on and you were so scared and your body's been secreting adrenaline and working overtime, and that adrenal thyroid axis has been depleting itself over and over and over again. So how do you treat that? You could say, oh yeah, just go on this, on a synthroid and now you're done. But what is that? That doesn't unwind any of the sequence of what's taking place. The thread is still very much there. And then eventually you go, medication dosage goes higher and higher and higher and higher until it doesn't work anymore, until now you got to switch to 2 different medications, and it's a whole thing, right? So by sort of tying the threads together is sort of how we guide them through this process.
Yeah, I like how you said unwinding. That fits in nicely with one of those main themes that we see running through Taoist practice of a reversion, going back to the source, of turning back
100%.
a clock or turning back a systemic process that makes us sick.
Yes, 100%. Yeah.
Rosie has a great question. She says, "Thank you for your profound presentation. If I may ask these questions out of my limited knowledge of traditional Taoist and Chinese medicine, how do we integrate this resonance to our modern medicine practice when we have to deal with diseases that are induced by microbes and virus, and open healing will not be enough?"
Yeah. So what I would say and invite you to do is to question very deeply the premises of this question, because embedded within your question is a particular construct and a particular way of thinking that has been imposed upon us by Western medical model. That has not always been imposed upon us, right? The people haven't always thought this way. We think it's the right way because it's modern and because we can sort of delineate and identify particular microbes and so forth. But Chinese medicine, first and foremost, is a medicine of the terrain. What's the terrain that allows for these microbes to take place? Where does the dysbiosis come from, right? We could say, oh, well, I was exposed to a virus and now the virus got in. Yeah, but if the terrain was strong enough, would that microbe have taken hold? Would it have created the sequence of events that have unfolded as a result of that microbe taking hold, right? And do we need some antimicrobial element, an agent, to get rid of it? Or do we need to reestablish harmony and balance within our system so that it normally and naturally eradicates this from the system by creating balance? We have microbes in our body that we live with that we couldn't live without, right? Billions of them. Our whole system is filled with a microbiome that we could not live without. The problem is imbalance. It's not a microbe that needs to be killed, right? It's a balance that needs to be reasserted. And that balance can only come from a proper understanding of terrain theory, right? Understanding where it's coming from. The stress and the terrain are two opposing pieces, right? They work together, and they have certain issues that have to be rectified. And so that stress could be a microbe coming in that the terrain is unable to deal with, right? And so there's tons and tons and tons of tools for dealing with that. And sometimes talismans are enough to deal with that. Sometimes language is enough to deal with that, right? Sometimes an herb is enough, or a formula, or an acupuncture prescription, whatever it is. So, don't get, I wouldn't get lulled into this buy-in to a Western medical paradigm and believe that to be truth. I'm not
Yeah.
saying there's no validity here. I'm just saying, like, you need to question all of these things and see the interplay between these different models.
That's a really good way, I think, to put it, Ross, because that's something that if you've studied Chinese medicine in detail, you kind of have to like understand that multiple systems are working at the same time, or some other system is working and we're just translating it imperfectly the whole time. I'm going to go over in my talk tomorrow a little bit about the mechanisms of Dao Yin, and some of the modern research on why it works is that stretching soft tissue in the body promotes an immune response. But if you don't have that one tiny bit of research, then, like open up the channel and expel the pathogen makes no sense to Western medicine. But once you have that research,
Of
it
course.
changes the entire way you think about movement and immunity.
And
Um,
again, what you're saying, language. It's
Yeah.
languaging. It's how to explain and express the reality. Because if you once you explain it in a different way, now all of a sudden you create patient buy-in. Now someone wants to practice Daoyin and get the impacts of it. But before, I don't know. I'm not just sure. That's just sort of stretching.
Yeah. Yeah, exactly. And
Yeah.
from a
Okay.
very specific lens. Yeah.
It's, it's a very great presentation. I think I can benefit a lot acupuncturist or someone want to learn the talisman to healing people. It's very great. But we have to know three things. The first, the patience. Be a patient, you have to believe it. Belief is very, very important. If you not believe it, we call the energy. Your energy is difficult to contact with the talisman. The second is the master or who the or Chinese doctor or the Taoist priest. You have to practice the energy or the meditation is so important. If the doctor or the patient or something that dies, someone the healer. Okay, talking the healer. If you're the how to say the field, everything is very very messy. It's no really can help people. This the Taoism is not just a paper or not just a word. It's important is the healer or the doctor. You have to really practice very very well. We say if the doctor or the healer, you have more power, there's more effect. This is the means you have to practice, so important. The second is talking about the talisman, we talk them, but not just the paper, it's the ink. No, it's ink. They all use herbs. Like you reading the stuff, the red stuff, it's called zhusha.
Yes.
Zhusha is, it's a good things. It's herbs. It's help people, make you peace, something like that. And they use gancao, use a lot of different things.
Absolutely. Yeah. Thank you. And that is one of the most important pieces that I'm hoping that I highlighted very well was that it's about creating the resonance. If you don't create the resonance and the buy-in with the patient, you are not going to achieve the type of success. And the cultivation of the practitioner is first and foremost a part of that process. 100% agree. These are the crucial elements that must come together as part of the alchemy to allow for the healing to take place within these healing spaces.
Yeah, I think these are excellent points. We'll finish with one last question. Do you suggest then, and this was in response to the last question, to have a proactive therapy of resonance, talisman and such, so that we can prevent diseases?
Well, there are lots of things that can be done proactively for sure. I mean, there are thousands upon thousands upon thousands of talismans out there, many of which are within the realm of sort of protection. And so absolutely, I wear certain things on my body and which I kind of create on a regular basis. I create different types of healing spirit water components. I have talismans that I change every single month on the front door and the back door of my house to protect it. So we absolutely, I mean, I think being preemptive and proactive always makes sense. It's always easier to prevent than it is to treat.
Awesome. Yeah, these were great questions. Ross, thank you so much for your talk. This is really enlightening and such a gift to actually offer a talisman to people. And yeah.
Oh, my pleasure. Thank you. I appreciate it. I appreciate the opportunity.
Thank you. We'll come back in about 12 minutes now at what is that, 2:15 Eastern time with Yuhua Meng and her divination talking about astrology. So we'll see you all in about 10 minutes now. And thank you, Ross, once again. That was wonderful.
Thank you guys. I appreciate it.
Thank you so much. Yeah.
Bye.